So on the PBR on these patients, do you recall where it was, the difference in
Well, this is 2 years after the infection. So as we already reported last week, that after 2 years, PBR values tend to normalize again, although you still have a lot of loss of your capillaries. So the average value of their PBR values was not that high. It was like slightly elevated, like 2.3 instead of 2.2, which should be in this group of people. But within that group, you have quite a range of PBR values. Some people have much higher values than others. So within that group, the ones that had higher values of PBR also had higher levels of keratitis or more eye issues. So that
right?
shows a strong correlation between people that had more damage also had more eye issues. And then
So it's interesting that, the eyes are they say the window to the body, but it shows up in the eyes very clearly, and it correlates with what we find in all the other organs happening. But it's also, I guess, want to drive home the point to our physicians that have GlycoCalyx systems, the importance of increasing the microvascular health score by increasing the capillary density and also lowering the PBR. I think a legitimate target people should try to shoot for is to get to 2, if possible, or
Oh,
below
your PBR value, yeah. And
on
then your
your PBR.
microvascular health scores, you want to get higher than that. You want to go into the 4 or 5 range at least.
Yeah, at least. Yeah.
And then confirm what you mentioned already, Bob. They found that the low capillary densities that they found in these patients systemically with the GlycoCalyx device, if they compare that with the eye and the retina, with other tools to measure the blood flow directly into the eye, they found a strong correlation. So not only systemically, but also in the eye, they could confirm that COVID infection really reduced the blood flow in the capillaries in the eye, and also areas without any flow, without any capillary flow in the retina. And then again, this other measure that they had, the wall to lumen ratio as a measure for cardiovascular damage, that correlated strongly negatively with your capillary density, meaning that the ones that lose a lot of capillaries have a low capillary density, they have a high wall to lumen ratio or a high cardiovascular risk. So again, confirming everything that we discussed before. So
essentially that put them in the same range as just the COVID, even 2 years later, put them in the same risk category as what you see in patients with high cardiovascular risk or the
yeah, again,
diabetes.
consistent with the earlier slides we discussed on the impact of COVID on the risk for a heart attack or stroke. They find exactly the same thing with other markers also in these patients with eye issues exposed to COVID.
And so they would see the same kind of things they would see in type 2 diabetes patients, where they see that degradation of what they see in the eye. They also see the effects of hypertension also. So the eye really tells a lot about the systemic health.
Yeah, it's another window, looking at your vascular health or your microvascular health. So
Right.
if it's systemically damaged, it shows up in the eye, and their other parameters like that wall to lumen ratio are consistent with our systemic measurements of capillary density and PBR values.
Yeah. Okay. Thank you.
So again, what can we do about it? No surprise that we are interested to see how we can improve microvascular health or also large vessel health and GlycoCalyx using Revasca. And I won't go into detail into all the different ingredients today of Revasca, but as you remember, we have many polysaccharides like fucoidin and hyaluronic acid rebuilding your GlycoCalyx, and ace-menin that you already mentioned before, Bob, to boost and support your immune system to fight the infections, and some other ingredients to reduce that oxidative stress levels and boost your nitric oxide productions to also boost your blood flow levels. So I want to show 2 data sets, one on in vitro, on cultured endothelial cells exposed to blood samples from really sick COVID patients. And I want to finish with that new data that was published today on the clinical trial in COVID patients using the GlycoCalyx supplement. So this is similar to the studies that we discussed before on cultured endothelial cells. So we have patients, in this case we have COVID patients, we take a blood sample. So we take the clear fluid, the plasma, out of those blood samples, and then we add that to a Petri dish, a culture dish in which we grow endothelial cells. And then we look how those endothelial cells respond, if they lose their GlycoCalyx, or they are prone to form blood clots or show all kinds of inflammatory receptors expressed on the surface, or even their permeability. Do they leak easily fluids and proteins over the endothelial lining? And instead of an atomic force microscopes, these images on the right are taken with the confocal microscope. So it's really a light microscope that shows images. And then we use different stains to stain for the presence or absence of GlycoCalyx. So the blue dye is just staining the endothelium, the nucleus. And then the green dye is staining for GlycoCalyx. So the more green dye you see, the more GlycoCalyx is present on the endothelium. And this shows if you have healthy endothelial cells exposed to controlled fluids, either from healthy individuals, the plasma sample, or just the culture media that you grow your endothelial cells with. You have very thick GlycoCalyx. If you take a blood sample from a person infected by the virus but didn't really get sick, didn't have to go to the ICU, then if you expose the endothelial cells to that fluid, there's still a lot of GlycoCalyx left. But if you take a sample from a really sick COVID patient that had to go to the ICU, and then you expose your endothelial cells to that, the toxins in the blood samples from these really sick ICU patients, you see a lot of the green dye is gone. And so that means there's a lot of breakdown of your GlycoCalyx. And that's also shown on the right-hand side. So these are just measures for how much of the green dye can be measured, how much GlycoCalyx is present. And it really shows that the really sick COVID patients in the ICU, their GlycoCalyx is significantly damaged compared to other healthy controls and people that do not get sick of the infection. So some more data from that same study. In addition to measure the presence of your GlycoCalyx, we also measured the expression of anti-blood clotting molecules on the surface of your endothelium called thrombomodulin. And similarly, if you lose your GlycoCalyx, not surprisingly, also you lose a lot of protective molecules that are associated with GlycoCalyx on the surface of your endothelium. So this is an anti-blood clotting molecule called thrombomodulin, and significantly reduced on the surface of your endothelium when it's exposed to the plasma of really sick COVID patients. So that also explains why your endothelium becomes very sticky, and it's very easy to form blood clots when you lose your GlycoCalyx.
So the interesting thing on those other slides there, you show the 6 weeks. So it appears.
Yeah, so this is just let me explain a little bit more. So this is some other markers circulating in the blood as a measure for infection or blood clotting activation or damage of the GlycoCalyx. So this is angiopoietin 2, which should be low circulating. If it's high, no, it's a sign of inflammation. It's really high in the patients that are really sick of the COVID, but actually turns back to the relatively normal level 6 weeks after people recover from the COVID infection. Same for soluble thrombomodulin. So that's the thrombomodulin that breaks off your endothelium and starts circulating in the blood. Now, clearly that goes up in the really sick COVID patients, and it normalizes again when you recover from COVID. And this is circulating levels of syndicin, so another measure again of your GlycoCalyx breakdown, which is really high in the really sick COVID patients. And it gets lower, but not all the way down. We saw in the other slide, there's also long haul COVID patients that it still keeps circulating at relatively high levels for months after the initial infection.
What do you think the difference between those patients would be? Just how?
Well, that I don't know. I guess nobody really knows. So some people have an infection, they recover, and they feel completely fine, no problem at all. And other people, they don't recover as fast, and they have issues for months up to years. Yeah, and the data confirm that these people also have, after 2 years, have damage to the GlycoCalyx. They have loss of capillaries. Their circulating GlycoCalyx breakdown products stay relatively high. They have all kinds of issues, and so they don't recover by themselves. But nobody really knows why some do and why others don't. Another measure in that study was the leakiness of your endothelium, how easy fluid and proteins leaks over your cultured lining of endothelial cells. And they measured the resistance. So the lower the resistance, the more leaky your endothelium is. And then it compares in gray, healthy controls, and blue, the COVID patients that didn't get sick, compared to the red lines or red dots for the really sick COVID patients. So it shows clearly that the really sick COVID patients, that endothelial resistance or the leakiness, the resistance really goes down, so the leakiness really increases. It's really easy to leak fluids and proteins over your endothelium. And these are just two different ways to look at that resistance.
So that's what leads to edema?
That leads to edema and also accumulation of large proteins like cholesterol in the vessel wall or your leakage of your albumin in the kidney.
Yeah.
And then there's some data showing that all these defects of a breakdown of your GlycoCalyx in the really sick COVID patients can be prevented if at the time of exposure to the virus or the inflammatory cytokines, whatever causes the damage, if at that time a GlycoCalyx supplement, like the fucoidin polysaccharide, that's one of the most important ingredients of our Revasca, if that's already circulating in your system, in your blood vessels, several slides I will show that it can completely prevent all these COVID-induced damages of your GlycoCalyx and other functions of your endothelium. So here it shows that compared to the really sick COVID patients, in the absence of fucoidin, the GlycoCalyx really recovers or stays at normal levels, even when exposed to the toxic plasma from the COVID patients. Fucoidin normalizes the expression of that anti-clotting molecule on your endothelium, the thrombomodulin. So anticoagulation is restored. And also these are two different measures for inflammation. So inflammation of your endothelium is really high in the sick COVID patients, and you can prevent it from happening in the presence of your fucoidin. And the same on the right-hand side for NF-kappa beta, another marker for activation of your inflammatory system. And one last slide from this study, just confirming that if you have the GlycoCalyx supplement circulating in your blood or in the presence of your endothelium, you normalize your circulating levels of von Brilevent factor, which is another marker for endothelial activation. You normalize angiopoietin 2, a marker for inflammation again. The cytokine IL-6 doesn't get as high in the presence of fucoidin, and also the secreted levels of that soluble thrombomodulin normalize to much lower levels, indicative again of preserving your GlycoCalyx in the presence of fucoidin. And the last slide also shows that the blue line is in the presence of fucoidin. This is again your resistance of your endothelium and how it can prevent leakage of fluid and proteins. So in the presence of fucoidin, you have significantly high resistances of your endothelium and preventing leakage of your fluids and proteins. And also shown on the right-hand side. So the resistance goes back to close to normal levels in the presence of your GlycoCalyx supplement. And on the lower left, it shows a picture of your endothelium, how tight they are connected. And there's all kinds of binding molecules between endothelial cells that are also related to GlycoCalyx. And again, confirming that in the presence of fucoidin, the tightness of the binding between endothelials is really much higher than in the absence of your GlycoCalyx supplements. On the right-hand side, more data about clotting. So these are circulating activated clotting factors. So this is activated factor 10, measured at different time points, but in the presence of your fucoidin, those factors really go down. Again, showing restoration of your GlycoCalyx anti-clotting properties. And also the levels of thrombin, which is another marker for activated clotting, significantly go down in the presence of fucoidin. So this is all in vitro. And these are the really exciting data that were published and accepted for publication today. by a study that we did. We also are co-authors on that paper together with Ignatios Economidis and many other people. He did a study on people a few weeks after they were infected by the COVID-19 virus. So initially, there were about 85 people that were eligible for the study. Further detailed examination, we had to exclude 23 people because they didn't meet some of the inclusion criteria or they didn't want to participate in the study. Then there were 62 patients left, and they were randomly split between the left arm, people getting the GlycoCalyx supplement for 4 months, or the placebo arm, getting capsules without any active ingredients. And then during the follow-up, some of them didn't complete the total study, so we lost 2 of them in the supplement arm and 3 of them in the placebo arm, ending up with 29 COVID patients treated with the GlycoCalyx supplements versus 28 patients with COVID that did not get the supplement. This is another way of showing the design of that study. So with 2 groups of patients, one that get a GlycoCalyx supplement intervention, one that just got placebo. They all had COVID a few weeks before the study started. And then for 4 months, they were getting the supplement, and a lot of functional parameters in addition to the GlycoCheck parameters were measured. So with the GlycoCheck, we measured the level of GlycoCalyx damage, or the PBR value. We measured also with different techniques arterial stiffness, both with pulse wave velocity measurements and what's called the augmentation index. Also interesting that circles back to our presentation on angina and chest pain in people that didn't have large vessel blockages but microvascular dysfunction. They also measured the coronary flow reserve using adenosine and compared how much your blood flow in the heart can increase during exercise. And the effect of the GlycoCalyx supplements on that coronary flow reserve. And finally, they also measured levels of oxidative stress. So the enzymes that we already discussed that are related to increased levels of oxidative stress. And they summarize some of the results on the right-hand side that show that in the group that did get a GlycoCalyx supplement, there was a significant reduction in the PBR value, so a reduction in GlycoCalyx damage. There's a reduction in markers for arterial stiffness, so pulse wave velocity and the augmentation index decreased significantly. Also, there was a significant drop in the circulating levels of oxidative stress. And also very interesting, they found a significant greater increase in your coronary flow reserve in the people that got the GlycoCalyx supplement. So the real data.
Why that's important, if you would, just real quick.
Well, that's important because that flow reserve in the heart that tells you if you start exercising and your heart needs to pump more blood through your muscles, so then the heart also is working much harder, and the heart itself needs more oxygen and nutrients at that time. So to do that, also in the heart itself, blood flow needs to go up, providing the heart muscle cells with more nutrients. So that difference between the blood flow that goes into the heart during resting conditions when you sit down at your desk, or when you get up and start exercising, then the blood flow also in the heart goes up because the heart needs more nutrients. And that ratio is called the myocardial flow reserve. And that, if that doesn't happen because of microvascular damage or microvascular dysfunction, then you get that pain on your chest when you start hiking in the mountains, Bob, and then you feel this chest pain. And we discussed in the session about microvascular disease and angina that a majority of people with that chest pain have microvascular damage. So it's very interesting to see that in this study, if you improve the health of your microvasculature with the GlycoCalyx supplement, you can also improve your myocardial flow reserve, taking away that angina. Now we've heard from people, case studies, colleagues and friends that are taking the supplement that were suffering from angina, that it actually improved their angina. And this is, I guess, one of the first study in a little bit bigger group confirming that finding.
Thank you.
So the real data are shown here, confirming what I just discussed. If you compare the patients getting the GlycoCalyx supplement compared with the ones getting placebo, so no supplement. This is the impact of 4 months of treatment on your level of GlycoCalyx damage, or PVR, significantly go down from the beginning until 4 months after in the treatment group, not going down, not changing in the placebos. This is the pulse wave velocity, measure for arterial stiffness, significantly going down in most individuals after 4 months in the GlycoCalyx supplement group, nothing happening in the placebo group. And on the right-hand side is the impact of the supplement on your coronary flow reserve, significantly going up in most people in the supplement arm, and no change or no improvement in the group getting the placebo. So just summarizing the findings.
Well, just if you can go back 1 second. So I think it's important to note, we get asked the question all along, how long does it take before you actually see measurable results? And so in this study that we were doing on people that actually had COVID, we could see a significant benefit and an improvement in 4 months as measured by.
Yeah, so that confirms what we usually advise, that at 3-4 months you should have significant improvement. So this study actually supports that claim.
Right.
And then summarizing their findings, people are getting the GlycoCalyx dietary supplement. They see that a lot of functional changes. They see reduction in the level of oxidative stress, see reductions in the level of inflammation, and they see an improvement in functions that are related to blood flow control. So that leads to restoration of your GlycoCalyx, reduced arterial stiffness, and an improved coronary blood flow in your microcirculation and coronary flow reserve. And overall, all these improvements result in an improved cardiovascular function. So I'm very happy that this really nice study got finally accepted and published today. So with that, Bob, thank you and all the people listening, and it's a word back to you again.
Thank you, Hans. So I think the presentation that we've done the last 2 weeks highlights several things. First of all, it highlights that COVID and the virus was a real thing, and it did have a significant impact on people's health. And that's why, you read things all the time where they estimate that maybe 50 to 60% of the people that had COVID still are experiencing long-haul COVID effects. And long-haul COVID effects would be manifest in dysfunction in organs throughout the body. So that's why people talk about, brain fog, problems with their brain, problems with their lungs capacity, their heart not functioning properly, that angina you talked about, kidney problems. And then we also talk a lot about the leakage of the fluids across the blood vessels. And so, that's why probably people have problems with neuropathy and other things that are experienced throughout the extremities. And so the importance of what we've covered is that COVID was an assault to our systemic microvascular system, and it was a real assault to the GlycoCalyx. And so the exciting thing that I think, and when this happened, I was excited to see, okay, what can we do to improve the outcomes? And so, I'd always taken 4 to 6 capsules a day regularly. As soon as COVID hit, I went to 8 capsules a day, and I still stay at 8 capsules a day because, at age 71, I want to keep my microvascular system as healthy as possible so I can mitigate the risks that might be lurking out there that could cause me problems. But it's really interesting to see, as we've gone through our talks the last 3 months, the GlycoCalyx is the largest systemic organ in the body because it lines your whole vascular and microvascular system. And it's amazing how when it breaks down, and we're able to measure that with our PBR measurement, our perfused boundary region, and then almost immediately we start to see a breakdown in what we came to recognize were really super important measurements. And that was your 4, 5, and 6 micron capillaries. And I'm just curious, Hans, why would the 4, 5, and 6 micron capillaries get wiped out, and why would they not recover? Do you have an answer for that?
No, well, we know that these capillaries are very sensitive. They're very small vessels. There's just one cell line. It's just endothelium. Larger vessels have multiple cell layers. So these capillaries are very, very vulnerable for damage, and they respond very dynamically to the tissue demand for nutrients and oxygen. So no, they wear down all the time, even in healthy individuals, and you make new ones all the time to counteract that loss and to match the need of your tissues to supply of metabolize oxygen and nutrients. So that's happening all the time. Just when the balance shifts towards damaging factors that break down your capillaries faster than you can make them, then you really show up very fast that on average there are lower numbers of your capillaries, and that's happening more in the capillaries than the larger vessels. That those numbers do not change that much. It's just at the level of the capillaries where new capillaries are being formed all the time. There you will see that change. So if you start shifting the balance between breakdown compared to production of new capillaries, it will show up in those capillaries way before anything else in larger vessels. So that's what we're doing with the supplement. We're not necessarily generating more production of capillaries. We're actually preventing the breakdown of excessive numbers of capillaries, and then your body itself knows how many capillaries you need and produces them, and you just protect your capillaries and make sure they don't disappear again.
Right. So there's the concept of angiogenesis, which is what you're describing, which is your body's constant creation of these capillaries I mean, it happens every day. You're producing.
Yes, all the time.
All the time, 24/7. And so what you're saying is the circulating stuff we've been talking about all this time in our different presentations, that's what breaks down these capillaries and it lets them not remain. And so the whole thing that we focus on is by giving the body the nutrients that it needs, it allows the body to keep these capillaries rather than them being wiped out. So I always tell people, I know I can restore your GlycoCalyx, but we also have to figure out what's causing the issue in your body that's causing those capillaries to break down. Because if we don't get on top of that, I know I can restore your GlycoCalyx, but if we don't understand what's breaking them down in the first place, it's almost like a dog chasing its tail. They break down as fast as we can restore them. And so that's why, sometimes blood results and different things, understanding what's causing that breakdown in the first place is super important to improving your health long term. And we know certain things do affect, like you've talked about different things that would cause like hyaluronidase.
Other risk factors, like smoking or hypertension or diabetes
Yeah, so high glucose levels would affect it. So basically, I guess if you can control your A1C or keep your glucose levels under control, that's going to stop the assault. That's why diabetes is really a microvascular disease, because it's wiping out those microcapillaries. Yeah. And so I think I really appreciate you going through this. I think we have some exciting data. I think the most exciting thing is, or the scary thing, and there's two things. I think that we're just starting to see the impact on morbidity and mortality rates as it results from the COVID virus, because you're now starting to see an uptick in the number of people with cardiovascular disease and complications, and the mortality rate is increased. And I think it's totally due to the damage that was done to the vascular system, for example, with COVID. And so the exciting thing is we do, as seen by our information we've shared today, we know what we can do to improve and allow the body to repair itself. So to me, that's super exciting.
I agree.
All right. Well, thank you, Hans, and we'll talk to you next week. Have a great one.
Okay.
Thanks for listening to the Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your GlycoCalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit GlycoCalyx.com to learn more about Revasca and how it can help you protect your future.